think the audience would definitely join me in recognizing the amount of effort and the work that's gone behind to weave so seamlessly those beautiful stories of a few characters. And so I just thought I'd start with you, Claire, really, just to tell us a little bit more about how you made the film. What were your main challenges? What were you really trying to achieve there on the kind of spectrum between information about a disease all the way to storytelling, really someone's experience?
Thank you. So indeed, I mean, as I told you before, we started this project in November 2016. We had never heard, Fabrice and I, about Noma before. It was quite a shock. The first time we met a Noma patient in Sokoto, so it's in northwest Nigeria. It was, of course, a challenge to visually tell this story. And we had a lot of discussion about it, including with Medecins Sans Frontières and also the national staff working either for Medecins Sans Frontières or with the Ministry of Health. It was a long journey. We were never sure of which patient we're going to meet because we went there 5 times during between November 2016 and November 2017. So we had no idea because the main challenge with Noma is that it's affecting people in extreme poverty conditions. So they are not able to communicate, or they don't even have a phone sometimes, or maybe only one person in the village has a phone, and maybe the phone will be lost or broken at one point. So even the medical team, they have a lot of difficulties for reaching the patients. So we were never sure of who we're going to see again, and it was not easy in terms of storytelling to be able to tell a full story. We knew from the beginning that we didn't want to have this before-after thingy that we can have and we can easily think about when we are considering such a disease. And I mean, this is something that people have been asking us, you know, to have this before-after picture, but it's not happening. I mean, there is no miracle. Each story is different, and we had to adapt and find ways to tell the story of the patient from the patient's perspective. They are survivors, the people you are seeing in this documentary, because 90% of the people are estimated to die within 2 weeks. So meaning only 10% may survive, but then living with an open wound in such conditions, you can imagine that maybe, and being affected by other diseases, including malaria, including many other diseases they can have in such places, they will have a challenge. We don't have data actually of how many will survive 5 years, 10 years. So it was really impressive to meet those survivors. They went through a long journey, and the idea was just to really sit with them, take a lot of time, and don't just look for the shocking image, because it could be something easy on this. But more to really take time, and you have noticed in the documentary there is not so many words, because, I mean, they are not speaking a lot, so we didn't try to have our perspective on their lives, but we tried to understand their perspective and their way of seeing things, and they're never gonna say something like, oh, I suffer, or, you know, it's a different way of seeing things and experimenting disability. So we tried to tell this story as best as we could.
Absolutely. And the music, you said, you know, you didn't want to, you couldn't draw very kind of, you know, crude testimonies from the patients. The music really fills in those gaps. I think it's a complete character in the film in its own right.
Yeah, and the music, I have to say, is a gift from the sound engineer who came with us from the second trip, because on the second trip, we noticed that it was very difficult, the conditions of filming and the fact that the patient have speech issues. It was very difficult to have a good sound quality, so a sound engineer joined us, and he's also a music composer, and he makes this gift to us, I mean, to compose this music, especially for the documentary.
Fantastic. Dr. Fotso, what's your background, and so what does this documentary really mean for your work and what you've been doing over the years?
Thank you very much, and I want to thank all those who came this afternoon to look at this documentary. I am the medical coordinator of MSF working in Nigeria, and I've been in this project for 28 months. My background is a medical doctor. I am a specialist, but in gynecology. I'm an obstetrician. But when I arrived in Nigeria with the 4 projects, Noma was one of the projects. And the battle I was doing for the maternal death shift to this horrible disease, where, as Claire said, what we know today for this disease is affecting the poorest of the poor. The most affected population is children 2 years to 6 years old. Started by just a little infection of the germ, but in 10 days can totally disfigure, and it's reported that 90% of patients died of this. Then for us, this documentary is one of the pillars of our activities, because our approach for Noma is to have this holistic approach with case management in the hospital, with this Noma surgery, with nutrition, with physiotherapy, with education, but we have the component, the outreach component, with 4 pillars, where we have this raising awareness in the community, is the follow-up and tracing, early detection, active case findings in the community, is a training of community health workers and other medical staff involved in the pyramid of the medical system in Nigeria, and of course, advocacy, because we want together to bring with us data to be able to advocate for this disease. Another aspect of our work is the operational research. But as we are discussing now, there are not many literature on Noma. And you introduced it very well, saying when you Google it, Noma, it was nomad. You are not going to see many things on that. And this is also why we are trying to bring the evidence base with the operational research to be able to have something available to share and to bring the other stakeholders together to fight against this phase of poverty. The risk factor of Noma is clearly known. It's poor oral hygiene, it's malnutrition, it's the poor coverage of vaccinations, especially measles, and it's other comorbidities we are seeing in the same location, HIV and all the other disease who can affect the immunity of the patient. Then as medical doctor and as medical coordinator of the mission, this documentary was for us also a tool to advocate with the Federal Minister of Health and the State Minister of Health to say, look, together we can do something to be together and work. And this also, WHO Afro have a group of inter-country Noma working group, includes 10 countries from Senegal to Ethiopia. Mostly, those countries are in what they call the meningitis belt. And this is also where we have the most cases, but Nigeria so far, and if I look at MSF work based on hospital data, we have the most robust cohort of patient Noma surgery But once again, this is hospital data for those who are coming to the hospital, but most of them are in a very remote place.
Mark, I see you nodding a lot. In perfect agreement with everything Adolphe has said. And how do you come to Noma, and what are your thoughts on the next step in the future?
Sure. So my name is Mark, and so I'm the health advisor based in Amsterdam. So Nigeria is one of the countries that I look after from a programming perspective. I'm also a physician, UK-trained doctor, and I have training in tropical medicine in Liverpool. And the first time I came across Noma was in South Sudan about 3 years ago. And I'd never heard of it before. And I saw the patient come in, a 6-year-old with the gaping hole in their face. And I was shocked. It's a shocking thing to see for the first time. But what is more shocking is that through all of my education in the UK and the NHS and all these this kind of high-end training I've got, I had never heard about this. And I find that shocking. And then it's when I come into this programming in Nigeria, we really got a really good opportunity to create awareness about Noma, because as Adolphe said, we really made big strides within Nigeria. It's been recognized by the Ministry of Health in Nigeria. We're getting huge amount of interest with them, training their surgeons, training their public health approach to Noma. Noma is now part of their surveillance system. So like measles or meningitis in Nigeria, Noma is now a disease like that hopefully should get picked up in the community. But the next step for us is actually how do we get this into a bigger picture, into a global perspective? Because we need more people to know about the damage that Noma does, but also the causes of Noma and how it's about rebuilding health systems and improving health in the community. It's a very public health approach. What you see here is just a surgical approach to what I can say is a very lucky few. But 90%, as I said, of the people who actually are affected by Noma die way before they even get to see a healthcare provider. So what we need to develop now is the advocacy and the knowledge in the greater, wider medical community, so we can start developing better public health approaches to Noma. And a big step for that would be to get Noma on the neglected tropical disease list at the WHO. This is a hugely bureaucratic process, but we need to really start now and really pushing this up into the top of the agenda. And hopefully then that we can have a bigger impact on the 90% who don't see the opportunity to access a healthcare provider.
Yeah, absolutely, and you mentioned getting on the neglected tropical disease list. I was just going to say that, this forum has a lot of neglected tropical disease. People have felt that for decades, had no money, had very little exposure. You're lucky, people can actually pronounce this disease quite easily, so that's a great bonus. And, through partnerships and through kind of a snowball effect in advocacy, many of these diseases have risen right up on the global health agenda. 2020 is going to be a massive year for neglected tropical diseases. New WHO roadmap, targets, and World NTD Day has been celebrated. So definitely the appetite and kind of the ears are all open out there to echo and promote diseases of neglected patients like this one. So it certainly feels like the time is right to be advocating for this disease. Is there anyone in the audience who perhaps has any experience to add to this, or any questions for our filmmakers? Any of your own experience in different diseases, perhaps of how, looking at Noma, how to boost advocacy quite rapidly in this field? And don't forget to introduce yourself as well.
Sorry. My name's Laura McCullough. I work for MSF Access Campaign. But actually, it's as a communication person, I just want to say it was an wonderful film, absolutely extraordinary. The kind of relationships that you explored and documented, I found incredibly moving, actually. So I'd like to thank you very much for making this piece. But I keep coming back to 90%. I mean, I also work on snakebite, where same issues, many people die before they get to treatment. And, that is the shocker. 90% die before. So, I don't know if there's a way to kind of make that concrete, or I don't know how one follows up on that to make that such a sort of shocking reality that might also, help this momentum and, push the visibility and the advocacy forward. Just a very minor comment, but thank you so much. It was an absolutely wonderful film to watch. Thank you.
Yeah, absolutely. Question at the front.
Hi, my name's Alex. I'm a practice nurse. I've got a burns and plastic surgery history, so some of that surgery is familiar to me vaguely. More on the youngest child whose mum said she's a burden. So from societal point of view, how might that young girl be supported now? Would her mum abandon her, or is it a story yet to unfold?
So, yeah, we really wanted to include this scene because, first we heard, when we researched about Noma, and what we heard is that there were a lot of stigma and isolation, but to be very honest, in the field we find families who are quite supportive for their beloved ones. So you can see Nana, the wife of Aliou, who is saying that she's gonna be with him until they die. Or, of course, he has two other wives who had run away before. Or Sakina, her mother is the only one eating with her, always taking time to go with her to the hospital. But of course, this is a burden for her because every time there is one people who is sick plus one caretaker leaving the family and the communities, and it's going to be a big loss for the family and the rest of the children. So, of course, she made this gift to us to share her worries. And I would say, I don't know the word in English, pudique.
Shy.
Yeah.
Yeah, they are kind of shy or yeah, they are very discreet about their feelings, so they are not so used to express their feelings because just basically I think, there is a cultural factor, but also the fact that they are living in extreme poverty condition. They don't have time to cry or to, they are living on a day-per-day basis. So, yeah, she was one of the few who opened her feelings to us. And it was very emotional. Something I wanted to mention, because speaking of Sakina and her mother, there is this opening scene also where we see Sakina being showered by her mom. And we had this collaborative process with the patients that we film. We always show them the footage to make sure that they agree and that they were really on board with what we were doing. And so Sakina's mother, we show her both this scene of the shower, and because the question of nudity was involved, so we wanted to really make sure that she was on board. And we show her also this other scene, and we expected her to be shy, and she was like, no, please bring this to everyone and share this, and I totally understand, and I want you to show this to the most people.
Just to add a little bit, that also in the general approach, we have a very clear photo policy, and we cannot use a photo of a patient without clear, informed concern. And within the team, we are very strict on that. Then this is something we need to protect the patient.
You can also, I'm adding again, you can also see this in the documentary, a way of sharing this with the viewers, because of course, making them sign a document when they are not even able to read or to understand, they don't know what is a TV or a print, so we were asking ourselves some ethical questions about the footage we were taking. And one way we found to create this link and to really make them understood what we were doing was from one trip to another to print pictures and to bring them back to them. And so you can see in the documentary this father who is keeping the picture. One day, I mean, we were not expecting it at all, but he brings it out of his pocket and he's keeping it in a little plastic bag. And we visited him at home later, and the picture was there in the room. And for them, it even became precious because it was like the only proof they had of what they looked like before surgery. So we tried to find ways to go beyond just like signing a paper, but really having an enlightened consent and having them on board and doing this film in a collaborative way.
I just wanted to say it's a really nice documentary. It really shows it feels like it shows the middle of the story, and it just brings so many questions, like what happened to them, why did it happen to them, how can it be prevented, and where does it lead us, what happens after. So it just brings all of these questions. So I think it kind of feels like there's so much missing as well from the story that we really just want to know more at this point. So I think it's a good way of bringing attention. It's a really good way of bringing attention, but it kind of feels like maybe you should give us some more background to this as well. It's really not a question, it's just a comment. Thank you very much.
No, but yeah, just to say, maybe Adolphe, if you want to say something as well. The idea was not to tell everything about Noma. This is very complex. We don't have data. We don't have, I mean, even doctors sometimes don't know about it. So, I mean, for us, we never worked before on a medical topic. So it was very new, and we didn't want it to go this way of like telling everything about Noma, such a complex thing. The idea was more to start a debate. So I really like your comment, because this is the idea. I mean, to give you a glimpse into the life of those people, and then to start a debate. And also there is a website that we have set up with Doctors Without Borders called noma.msf.org. And I'm very sorry it's not popping up on Google, but it should, because it's really well done, and you have all the information you can on this website. And also we try working together on this to change a bit the narrative, because sometimes there are very shocking pictures online, and you just click on this NGO website and you are so shocked that you just close it. And we try to including working with a graphic design team, you know, to do something which was accessible for the general public.
Thank you. I'm from the Lancet. My readership would be interested to know about treatment. It was implied in the film, I thought one of the kids was reinfected, and the attendant said, you know, we can treat that. There was a small hole and it could be rectified. Was that a surgical intervention, or is there something that can be given?
Thank you for this question. And this is also to give a little bit to the previous question. The way this documentary was made, it was just not to make it very medical approach with etiology, what is etiology. No, it was just to bring this. And now, when we look at Noma, we have Noma in two phases. We have the acute phase, and this is where the early detection is absolutely key, where just dressing antibiotics solve the problem. Now, when we are in post-Noma defect, that means the stage, they classify Noma on 5 stages. When you have stage 0 to 2, this is what the acute phase, where antibiotics, oral hygiene, oral dressing can solve the problem. But now, when you are already at the necrotizing phases with secular, this is where the surgery is there, and it's very complicated surgery, involved the very specialized maxillofacial plastician surgeon, and the anesthetist need to have very good skill in fibro-optic intubation. Yeah. Then this is why one of our key message is early detection. Because with early detection, just a simple metronidazole and oral hygiene dressing solve the problem.
So you must be fairly certain this is bacteria. This is happening. Is it allowed now?
Yes, there are surely infection because it's in an infection of the germ. Now, in literature, there are many questions of who is, what germ is really the one. Fusobacterium necrophorum has been identified from some cases, but no one today can say it's only Fusobacterium necrophorum. Yeah, then it's an infection. This is why antibiotics at the stage 0-1 is part of the treatment, and we saw the problem is solved. And we have this in our hospital data. We have patients with what we call acute Noma or fresh Noma. Those patients don't need this complicated surgery. Those who are now coming with the secular, this is those who need surgery, and in the documentary, it's not only one. Sometimes 12. Some patients need to have many stages of surgery to be at the end have the results we are seeing.
I'm May Sule from Imperial College, London. Thank you very much. That was really very enlightening because I'm from Nigeria, I'm from the state bordering Sokoto, and I've never heard of this before. So I think massive awareness, advocacy is very important here. I don't know how much of the film has been shown nationally in Nigeria to make people aware of it. I remember with VVF, just documentaries created so much awareness and it made the government to act. So I don't know what you're doing about putting this documentary forward to probably the NTA, the National Television Authority, to air it, for example, just to raise that awareness. I know you said the government is already doing something, but they can be slow, and creating that awareness can push them to do more.
Thank you very much. Last year, during the National Noma Day, because Nigeria is one of the countries who has implemented this Noma Day, and since 3 years now, every November there is Noma Days. In 2018, the first draft, the short version of this documentary was presented in front of the Federal Minister of Health. And last year, during Noma celebration at Sokoto level, it was used at Sokoto level to bring people first to know that they are part of this history. And yes, you are right, we need to push more and to see how to make it at large as possible. And with that, Claire is totally okay with that. And
sure.
We discuss a lot. Yeah? This is why I want to make it publicly. We discuss a lot on that.
Yeah. No, this is the objective. So, yeah, indeed, the patients were the very first and the community in Sokoto to saw the documentary a bit more than a year ago. Some of them, after seeing the documentaries, they were like, oh, okay, we want to be ambassador for Noma now, and they even brought some patients for the intervention who was happening at the same time, so we can really see direct results in the community. And last November, we had a screening tour in partnership with the French Embassy and, of course, Doctors Without Borders across Nigeria. So the film was shown in 10 cities across the country, and we met a lot of people in the south. We were also presenting the film at the Africa International Film Festival in Lagos, and a lot of people, they had never heard about Noma in the country. So it was really interesting to share this and discuss about it with Nigerian. So yeah, we have been working on this, but of course it can always be seen more. Many people who took part in those screenings, they are now even bringing it to their own universities or schools or hospitals. So this is like a virtuous circle that we are trying to create here.
Got time for one last question or comment. Oh, right at the front. No rush, no rush.
I'm Hayley, I'm a nurse, was doing travel health, do a little bit of global health, a little bit of education. Mine's a comment, and it's thank you for being brave enough not to do the easy thing. It's very easy to pick a fictitious point, and this is the beginning of Noma. Then show the middle, and then the happy clappy, this is the end. They have had the operation, and now it's all fairies and unicorns. There is no single starting point. Any starting point you picked would be fictitious. It's a multitude of things that create this problem, and it doesn't ever end either. So it's delightful to see the honesty with just the middle being shown. And I've seen a few film screenings, but never one that has generated quite the level of interest and ongoing questioning that not giving a nice tidy packet of beginning and end has created here. Thank you again.
Thank you. I'll agree with Hayley that there's been a lot of, you certainly elicit a response in every single viewer. And before we break up, riding on that feeling, what would you say that each single person here should now go and do to push forward a tiny bit the advocacy for Noma? In your ideal world, what can we all now go home and do? Mark, do you want to start?
Yeah, start with the MSF webpage, noma.msf.org. There's lots of information on there where you can actually kind of read around the area a little bit, and if everybody took one person and speak to them when they're back in their day jobs, not tomorrow, then maybe the next day if you're here tomorrow, and just tell people about it and direct people to the website. And slowly, if we can build up a kind of bit of a network of people who actually know about this, we can start to build a momentum to have an impact.
Great. Claire?
Yeah, and if you have any idea of where to show or you want to bring this to your communities, please get in touch. There is some postcards at the entrance with my contact, so please feel free to reach out. This is also how things are happening, so yeah, please join.
And Adolphe, to conclude?
Just to conclude, just to say Noma is preventable. The risk factor of Noma is poverty, but poverty is vague. It's poor oral hygiene. We can address that. It's a poor coverage of vaccination, that we can address. It's problem of nutrition, malnutrition. The second thing is the early detection bring the patient to have a quick reaction or the quick case management, and with very few amounts of money, we can address Noma at the beginning. The third thing I want here to share is Noma needs a holistic approach. When we look at the documentary, the stigma in the society, the cosmetic in our study with the 628 surgery performed since 2015 to December 2019 in Noma Children's Hospital, when we look at top 3, a reason of the patient, most of them to come to the hospital, is cosmetic, is stigma, and third is the disability. Then we need to bring people and to say, please, Noma is not so strange, but let us focus on early detection. Is cheaper than the high, complicated, sophisticated surgery with very costly to the poorest of the poor.
Right. Points well taken. We've had a very full day where we've been talking about communication, advocacy for global health, diseases. Here we are, right in the midst of doing that for Noma. So please, go home today. As Mark said, share it with your friends. You've seen a film today, direct them to the trailer on Vimeo. They might continue to share it. Also, if anyone wants to arrange a screening, get in touch with Claire. And ultimately, I think this is what this day is about, and in particular about Noma, just to really address those issues highlighted by Adolphe, prevention, and kind of tackling the causes right at their cause. So on that note, I think that was a beautiful conclusion to what we've been trying to do today. I'd like to thank the panelists here now. Thank you very much for coming to the screening, and we hope to see you bright and early tomorrow. We're focusing in tomorrow's part of the festival on a lot of tools. There will be workshops and moving a little bit away from the policy kind of discussions to very practical approaches, whether it be within filming or a theatre workshop, all sorts of things tomorrow. So hope to see you bright and early, and have a lovely evening. And again, a massive round of applause to our panelists and for the documentary. Thank you.